Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the pharmacology of the warfarin. Warfarin is a coumarin anticoagulant. Warfarin and its congener dicumarol, these are discovered in the University of Wisconsin with the help of the local farmers. They found that a natural weed mixed with grass, that is the red clover, when the cattle used to take those grass, the cattle has bleeding from their nose. So it was discovered in that way. So warfarin, this stands for Wisconsin Alumni Research Foundation, and we add ARIN, warfarin. Okay, so this is the anticoagulant. And this anticoagulant, what it does, it antagonizes the cofactor function of vitamin K. It antagonizes the cofactor of vitamin K. So it antagonizes the cofactor function of vitamin K. Cofactor function of vitamin K. Therefore, vitamin K dependent blood clotting factor cannot be synthesized. So, vitamin K dependent coagulation factor are not synthesized. Okay, what are the vitamin K dependent blood clotting factors? These are factor 2, factor 7, then factor 9 and factor 10, factor 9 and factor 10. So these blood clotting factors cannot be synthesized by the liver because they need the cofactor function of vitamin K. So as because the warfarin is a vitamin K antagonist, okay, warfarin is a vitamin K antagonist. Okay, so warfarin antagonizes the cofactor function of vitamin K, and vitamin K dependent coagulation factor like 2nd, 7, 9, 10 cannot be synthesized. So this is the mode of action of warfarin. This is the mode of action of warfarin. We got that mode of action. Now we'll go to the pharmacokinetics. Now we'll go to the pharmacokinetics. Warfarin is taken by mouth, so it is taken orally. And it is absorbed, but it absorbs nicely from the upper intestine, but its mode of action is late. It may take 8 to 10 hours to come into action, and also it will sustain for a longer time. The warfarin, it is taken orally, okay. Delayed mode of action, delayed, we can say onset of action, maybe 8 to 10 hours. Okay, and it may stay couple of days its action. Okay, and also we must know that once it is in the circulation, it is attached to the proteins, attached to the plasma proteins, and it does not go to the CSF, does not go to the breast milk, okay, does not go to the CSF and the breast milk, okay. So in the liver it is conjugated in the liver. Warfarin is conjugated with the glucuronide. Warfarin is conjugated by the glucuronide. Okay. Then it is excreted through the stool and urine, then excreted through the stool and urine. Okay, so this is the fate of the warfarin. Okay, we got that, but we have to know that its therapeutic index is very narrow, short therapeutic index, or we can say small or narrow therapeutic index, or narrow therapeutic index. Okay, small or narrow therapeutic index, that means it works up to certain doses, but if dose is little increase, there may be toxicity. So that is the way. So when it is administered, physician always look for PT, that is prothrombin time. So series of PT for several days, along with INR, that is international normalized ratio. This should be studied, should be assessed properly to assess the action of the, to to assess the or you can say to quantify the anticoagulant action of the, okay, these are essential to quantify the anticoagulation function of the warfarin. Okay, so that is very essential to do series of PT and INR studies. Okay, we got that. We got the pharmacokinetics. Now learn the therapeutic indication. Why we use the warfarin? That is very important to us. Therapeutic indication. Okay. Therapeutic indication is to a person who has mechanical prosthetic heart valve. A person has mechanical prosthetic heart valve. Very important. The management and prevention of venous thromboembolism. In the management and prevention of thromboembolism in the management of atrial fibrillation, in atrial fibrillation, atria contract very quickly and there may be no exact force of contraction, so there will be formation of blood clot, even that may lead to stroke. So it is a management by means of warfarin to prevent the blood clot formation and stroke. Okay, so it is useful in a history of previous myocardial infarction, Okay, there is another use, and it is used in the management of episodic systemic embolism, management of episodic systemic embolism. Okay, we got the therapeutic indications of warfarin. Okay, we got the therapeutic indications. These are the useful use of warfarin. Warfarin is taken by mouth. Okay, there is a usual way of management. Okay, we got that therapeutic indication of warfarin. Okay, now we learn the adverse effects of warfarin. Adverse effect. First of all, is because it is an anticoagulant, so there will be chance of hemorrhage or bleeding. Bleeding is very common complication. Bleeding may be from any site. It may be intracranial hemorrhage. It may be hemorrhage inside the intestine or from the nose So there may be intracranial hemorrhage, there may be hematemesis, melena, vomiting of blood, hematemesis, melena, that means melena, okay. Melena, that means black, tarry and sticky stool. It will alter blood coming out from the intestine, from the stomach, maybe from jejunum, even from large intestine. Okay, so there will be bleeding, very common condition. Most important is the drug interaction. Okay, why it is so important? Because our warfarin is metabolized in the liver, metabolized in the liver, we must in our pharmacokinetics, okay, by the cytochrome 450 enzyme system, okay, of the liver. So there are some drug interaction that will increase the anticoagulation effect, increase the PT and anticoagulation effect, anticoagulation effect. What are those drugs? That is very important. Okay, these are the sulfonamide, because sulfonamide will compete with that of the warfarin for the plasma protein. Okay, sulfonamide, NSAID. Sulfonamide is an antibiotic. Okay. Sulfonamide, NSAID, like that of aspirin or phenylbutazone. Okay, so cimetidine and anabolic steroids, cimetidine, antipeptic ulcer drug, anabolic steroid, that will increase the PT and anticoagulation, more chance of hemorrhage, steroid, chloramphenicol, steroid, other drug like steroid, like anabolic steroid, okay. Chloramphenicol is very important, okay. Chloramphenicol is an antibiotic. It was very popular for the management of enteric fever or typhoid. Other medication like that of acute alcoholism or disulfiram intake, okay, alcoholism or management of alcoholism by disulfiram, okay. So these are the drug, and also we have some of the anti-arrhythmic drug like amiodarone, anti-gout drug allopurinol. So that will increase the anticoagulation, increase the PT like that of allopurinol. Okay, there's an anti-gout drug. Okay, other anti-arrhythmic drug like that of quinidine, amiodarone, they also increase the PT. Some drug decrease the PT, and decrease the anticoagulation. So it is increased, okay, and decrease the anticoagulation. What are those drugs? These drugs are the anti-TB drug like rifampicin, or the anti-epileptic drug like carbamazepine, phenytoin. Okay, so antifungal drug like that of Griseofulvin, okay, like rifampin. What is the drug? This is the anti-TB drug. Griseofulvin, antifungal drug, very good in ringworm. Okay, phenytoin, anti-epileptic drug, phenytoin. Okay, so like that. Another drug like that of glutathione, and certainly other drug like OCP or oral contraceptive pill, okay, cholestyramine, so like anti-bile acid drug, cholestyramine, so they will decrease the PT and decrease the anticoagulation. So drug interaction is very important because of the cytochrome P450 enzyme. Okay, so we got the drug interaction. Now we have to know the contraindications. Contraindication of warfarin. Contraindication. This is very important. Pregnancy. During pregnancy, this drug should not be taken. If the pregnant woman has prosthetic heart valve or there is an indication for anticoagulation, then heparin is the drug of choice during pregnancy, not the warfarin. Warfarin can cross the placental barrier, can cause harm to the developing fetus embryo that may lead to congenital birth defect, even may lead to abortion. Okay, and that's all about the pharmacology of the warfarin. If you like my video, please support my channel. Please subscribe me and share the information with your friends. And have a nice day. Bye now.